Welcome back to Did You Know, a podcast by Partner Veterinary. In this series, we explore all things veterinary medicine and all things partner. In each episode, we will answer some of the most common questions we are asked, from oncology to emergencies and everything in between. If it happens at Partner, we'll cover it. In honor of National Veterinary Technician Week, this episode features Jamie Wesolowski, an LVT, RVT, and a VTS in oncology. Listen to hear Jamie's journey from an early interest in veterinary medicine all the way to finding her place with Partner.
Welcome, Jamie. Can you tell us a little bit about yourself and how you got started in the veterinary profession?
Yes. Hi. Thank you. And thanks for having me. I'm Jamie Wesolowski, and I have my associates in applied science. I have my bachelor's in science, and I'm a RVT and an LVT, and then also I'm a VTS in oncology. I feel like I really started in the veterinary profession pretty young. I know that everybody kind of has one of those stories. Oh, when I was little, but I really did have a story when I was about 2 or 3. My grandma's cat, she would just not eat for anyone. And for some reason, I just kind of embraced the cat, and I just felt like I started hand feeding her. And I feel like at that moment, obviously that was a very young moment, but I feel like my parents always kind of reminded me of that. And I feel like that's probably where I started in vet med, was at least the love of not just pets, right? I knew I wanted to care for pets, and their owners, honestly, because the joy that I got to see out of my grandma when, we were able to get her cat to eat was pretty heartfelt. And obviously, like I said, I was very, very young, but I feel like when I hear the stories of my parents telling me about this, I feel like that had to have just been kind of my starting point of when I knew I wanted to be in veterinary medicine.
How did you get involved in your profession?
So I feel like a lot of us, I too started with volunteering at different shelters. I started very young. I mean, I started in kind of elementary school, where I was going and just kind of shadowing some of the people in different rescues or shelters. Then I started volunteering when I was in middle school and high school at a few of our general practices around. I always thought that I actually wanted to go to vet school. So I went to Indiana State University, and there I was kind of in the pre-vet course. And at that point, I actually started working at a general practice, and I was just doing kennel work, things like that, and then started coming on my days off and working with the veterinary technician. And at that point, that's really when I knew that I was going to shift from wanting to go to vet school to pursuing a career in nursing. And so after I graduated with my bachelor's of science from Indiana State, then I got accepted to Bellray Institute in Denver, Colorado. And it was such an incredible experience out there. So it was 2 years year round, and it was by quarters. So it was pretty extensive, but fantastic education that I got there. I did my internship at a GP, but I kind of always knew I was not going to stay in general practice. Once I got out, I worked at a general practice for about 6 months, and I just knew it wasn't really for me. So got a position working in emergency. And actually, I moved back to Indiana and started working at an emergency hospital, worked there for about 2 years, and then moved to where I am now in the suburbs of Indianapolis. Started with working with a criticalist at the hospital, and then randomly I was asked to start up the oncology department. And I was like, sure, why not? I've never done oncology, but let's try it out. So I pretty much started the entire department by myself with the doctor. Did a lot of learning on my own, but then lots of questions to my oncologist. And that's kind of how I ended up being in oncology. I just fell absolutely in love with it and couldn't imagine doing anything else, in my career.
So what is your role with partner?
So my role is pretty unique. We've actually kind of just made up the role a little bit in the oncology department for Richmond. I'm kind of working almost as like a nurse practitioner type of role. It's something that we're kind of leading up to. What the idea is that I'm going to be doing these pre-visit kind of consultations with the clients, where I'll be going over the cancer itself. I'll be going over staging, treatment options, and then I will go over a little bit on, the finances and things like that. If the clients decide that they do want to pursue with everything that we've talked about, then they actually come into the hospital, meet Dr. Miller, and then we'll pursue on from there. So that's kind of what the end goal is, what my role is going to be. But right now I'm doing a lot of team training, a lot of mentoring within the hospital. I am a hybrid. So I actually work half of my time in Indiana, and then I'll do some of my time in Richmond. So that's a pretty unique circumstance, which I never thought in veterinary medicine I would ever be able to do something like this. But it's a pretty unique role, and I'm loving it, and it's kind of developing as we're going, which is even more exciting. Just to find the different ways for my expertise of how I can, be the right hand man to Dr. Miller, but then also support and guide the team as well. So it's a pretty exciting role that we're developing right now.
That is exciting. And it's exciting that that's a part of the way that Partner is reimagining the veterinary profession, is that we are allowing staff to do hybrid roles like that. That's pretty exciting. Why did you choose to work with Partner?
So kind of that big thing of them just seeing the vision and what I can bring to the field and what I can bring to oncology. I feel like once I became a VTS, which it was incredibly exciting, and I'm very proud of the accomplishments that I was able to do. There's been a lot of people just don't know how to utilize a VTS properly, at least in oncology. And so I just had a vision of how I wanted to be able to be utilized. And I think that was scaring a lot of people off, that was kind of surprising to me because, we are in veterinary medicine trying to find new ways of treating patients. And I was finding a lot of roadblocks with people who were very interested, but nobody really was like, okay, yeah, let's do it. And
can I ask real quick, what is a VTS? What is your role as a VTS?
Yeah, that's a great question. So VTS is a veterinary technician specialist. So I have additional training that I did kind of on the job training, where I had a very extensive application that I had to do. And you have to be in the field for at least 3 years and in oncology. Yeah, very extensive application process where I had to do 75 logs. I had to do 4 case reports that were 10 pages each. I had to come up with different exam questions. I had to get references. But the logs and the reports are grueling work. It's so much. So the whole process takes a little over 2 years. And so that's kind of, in a very quick nutshell, what, the VTS application process kind of looks like. Then once you get approved, that your application has passed, then I had to sit for boards that were a 400 question board that I had to do then as well.
Okay. And so then that is why that brought you to Partner, because they allowed you to use this within the hospital.
Yeah, I would say that Partner really understood, at least was very open to how we can utilize a VTS in a clinical setting, and not just, okay, yeah, we have a VTS, but let's keep them doing the exact same thing, right? So Partner really understood that vision that I had for myself, and again, what I could bring to veterinary oncology. And then I had worked with Dr. Miller previously. And so I knew that she and I had a very very much similar vision of what we want for oncology and for our patients and clients. And so we just kind of reconnected, and yeah, partner just really understood kind of what I want for my career, what I want for my path and journey, and what I want to be able to provide for patients and clients. And so partner was a good fit for me, and what I'm trying to do for my career.
Excellent. What has been one of the hardest moments in your career?
I know that everybody that everybody has this viewpoint that oncology is just sad all the time, which that would be very ignorant to say that it's not. But honestly, I feel like a lot of the times what's most challenging for me is those times where either one, we have gotten to a point where we're in treatment and we have just kind of run out of drug options. In veterinary oncology, we only have a limited amount of drugs that we have seen that actually are efficacious and actually are going to work for our patients. And so that gets pretty heartbreaking, where you have those clients that want to treat, that will do anything, and we just run out of options, right? And then it gets to the other point of the complete opposite spectrum of you have clients that really want to do things, but they just don't have the finances. Or we've started treating and things are going really well and they've just run out of money. And that is an unfortunate reality in veterinary medicine, where finances really are a big driver of what, it is, I hate saying, but it is a big contributor of what we can do for our patients and clients. Right. And so, I would say those are kind of my biggest hurdles that I feel like in oncology, at least, that I'm coming to where it makes it difficult for not only for me to do my job, but then it's difficult on the heart, and I will say a lot of times I have seen so many clients be able to do so much for their pets because they have insurance, right? So insurance really has made a big difference in how we can treat our patients. I look at in human medicine, and we never talk about finances, right? You go into the emergency room and they do the golden standard every single time. You just don't talk about it. And so in veterinary medicine, we would love to do the golden standard for every patient, but it's just reality is that we have to talk about finances. And so I've actually seen, I know this is obviously not what's been hard in veterinary medicine, but at least I've seen with insurance, we can say, hey, this is what we would like to do. And, oh, you don't want to really talk about finances? You have your insurance? Great. Then let's do everything we need to be able to do. So those are the biggest, I feel like, struggles, at least for oncology, that I really run into. And can impact a lot of things in what we do.
Yeah, absolutely. What experience has had the biggest impression on you in your career?
And there's so many. I feel like a lot of it is the people that I work with, fellow technicians, fellow doctors. But honestly, being in oncology, I would have to say, honestly, my clients are kind of the biggest. I mean, man, I don't even know how to explain the connection that we're able to make with our clients and patients is just so incredibly special in oncology. We're seeing some of these patients weekly. I might be talking to clients, especially with my role. I do such heavy education with clients that I'm talking to them constantly. And so the relationships that I get to build with these patients and clients is just hands down the most rewarding sometimes it's hard for me to put into words how wonderful that experience really is for my career. I've had so many clients that have impacted clients and patients that have impacted my greatest memories, honestly, in veterinary medicine. And there are still some clients that I talk to still to this day. I have some clients that it's been years since I've treated their pet. Their pet's now deceased, and they will comment on, a Facebook post that I made, like when I got my VTS, or when I started with Partner, some of these clients are still, being my advocate, which is just incredible. I've got to experience so many ups and downs with patients, right? Some of the patients, I really try not to get so connected, but it's impossible, right? The patients in oncology, if you've not got to experience patients in oncology, again, I feel like the perception for people is that they're always sick, they're not feeling well, and that it really is not the case. For a majority of our patients, they're going to be the ones that are hip-hopping around the hospital. They're the ones being crazy, especially the three-legged dogs. And so it's really fun to be able to get to know the patient's personalities and their little quirks. And, I did a lecture a couple of weeks ago, and one of our patients, he will sit in his kennel, and he's just this big fat-headed kitty. He is the most handsome boy in the entire world. His name's Benny. And he just looks so sad in his kennel. And so my lecture was about, exposing oncology myths. And so I put that picture up, and I put the ASPCA, Sarah McLachlan song, because he just looks so pathetic and sad. And then I'm trying to get through this because it's funny. And then the next picture I had, his face is just completely smushed up against his kennel, and he just wants treats. And it's like you can almost visualize his face just going down the window, and it's like that, And so then I have this party, pump up song, and it's just things like that, right? That just make my day, that make it so exciting to come into work. And yeah, just the impact that those kids can make on us is just incredible. And then I would say another impact that has really been something on my career is after we've lost a patient, the outreach from the families is just, it's just incredible. Just the gratitude that they have, the love that they have. It's sometimes it can be a lot, right? It really can kind of overwhelm your heart on how impactful we made. I'm gonna get teary. The impact that we've made on their family. Oh, I'm sorry.
It's okay. It's okay.
Just the impact that we've been able to make family. And then they want to thank us, right? They want to show how much that we mean to them. And that really says a lot about what we can do in our field. And it really makes all those sad times worth it. When we get all these cards and, I got a video from a client the other day that they were celebrating his last chemotherapy. Just those impacts just make it, God, it's a really, really special specialty that I'm in. And I know that everybody is going to say I'm being biased, but it really is a very, very special department. And so, yeah, I would say that those are the biggest impacts. And like I said, of course, my coworkers are great, but the patients and clients are really. Well, I will say too, one thing that I really love about working with some of the oncologists that I have, especially Dr. Miller, or I'm going to go from not being sad and happy tears to. One thing that I love about Dr. Miller, Ryan, is that we can just sit there and just talk about medicine all day long, and that is just such a cool feeling that the doctor wants to hear my input, right? She wants to hear how I've experienced some of these cancers or, some of the treatments that we've tried. And so that's something that's also been very fulfilling in my career, is just being able to have that fulfillment of just talk medicine, and just bounce ideas off of each other and how we can improve, again, just treating patients. That's something that's so exciting and fun for me and very nerdy, but I love it. So yeah, I would say that is a long, long answer, but those are probably my biggest impacts for being in oncology and what I do.
That's fantastic. That really is. And I think that showing how emotional it is, you folks are very very committed and tied to your patients and to the clients. And that is the reality of this. This is hard for you folks as well. It's hard for the teams at the hospitals as well. And that is the reality. And you guys are in there every day doing the best that you can for these patients and for the clients.
I know. And that's a tough to navigate, right? You know, it's like you don't want to let it engulf you. But again, it's just so hard not to when you've learned to love these patients, you know, like you have, like some of the patients that have really touched my heart the most, like I have incorporated them into my life. And, you know, like, I feel like that's a service that I want to do. You know, I don't have to do it, right? It's because they have impacted me. You know, and I think that when I can allow them to be in my life, whereas that will hurt, you know, just as equally as if I'm losing my own, I think that just shows, you know, the type of commitment that I want to have to my patients and that I have to my clients. And, you know, it can definitely be overwhelming, that's for sure. And I think that in vet med, you know, just in general, I think that all of us do take a lot of that burden on, as do, you know, human medical professionals. And I know that, you know, talking about mental health is really a big thing that we're all trying to work through, especially with how COVID, you know, impacted everyone so much. But yeah, I mean, I don't know any other way, right? Other than just allowing them in my heart. And I think that that's the best way I can treat patients and clients. And so I don't know if that's always good.
That's why you got into this profession, I think. I think that's why a lot of you folks have gotten into this profession. Yeah.
Yeah.
Thank you for listening to Did You Know? Is there something about Partner that you want to know? Email us at letstalk@partnervesc.com. Who knows, we might turn your question into an entire episode. You can now find us wherever you listen to all of your other favorite podcasts.